Hi, I'm Dr. Bill Berkowitz of Life Chiropractic in Grass Valley. Welcome. Let's talk about fibromyalgia. There is nothing much more devastating I can think of on a daily basis than fibromyalgia. It robs you of your vitality, of your energy. You live in pain. So let's talk about three little known critical factors in successfully treating fibromyalgia. First of all, fibromyalgia, the underlying cause is some kind of interference due to long-standing stress that has created an imbalance that the body is having a difficult time resolving. I've written elsewhere about how fibromyalgia, the symptoms are very similar to chronic stress, chronic fatigue syndrome. So there's a commonality here. So let's talk about three factors that I have found successful over my more than 35 years of clinical practice in helping people with fibromyalgia. The first is structural balance. We need to bring the body back in balance. If your pelvis, which is the foundation of your spine, is not balanced, then your body's going to work all the way up your spine until it gets to the base of the skull, trying to bring you into balance. And if your pelvis is unbalanced, your head is going to be out of balance. And if your head's out of balance, then there's pressure on your brainstem. So structural balance is factor number one. Factor number two is to remove sources of irritation to the sympathetic nervous system and the vagus nerve. Collectively, that's the autonomic nervous system. Lots of that happens up in the brainstem. It can also happen in the lower cervical spine. It can happen in the tailbone, again to the vagus nerve, and it happens through the mid and lower back to the sympathetic system. What happens is the sympathetic fight or flight system becomes overactive. Over time, this becomes the dominant place that you live from, and it fatigues eventually. They used to call this adrenal fatigue syndrome. In fact, some people do, but it's not an adrenal problem. It's a nervous system problem. So we want to restore balance to the autonomic nervous system. We want to allow the vagus nerve to function, because if you think about what the vagus nerve does, and I'm going to list a few things in a minute, that it will sound like the perfect balancing to what you're experiencing with fibromyalgia. Vagus nerve lowers heart rate and blood pressure in general, decreases inflammation, lowers muscle tension and pain, especially through the neck and shoulders, but all over, improves the quality of sleep, diminishes anxiety, improves the function of the immune system, improves digestion. So the vagus nerve is critical to your overall health and well-being. So the third factor is we want to activate that vagus nerve. Fibromyalgia is a very chronic condition. Likely the imbalances leading to the emergence of fibromyalgia took place over years and likely decades. And eventually it led to such an imbalance that fibromyalgia pain emerged. So it's going to take a period of months to activate the vagus nerve. And the more ways you do it, the better. It's sort of like working a muscle. The more you use it, the stronger it gets. And the stronger it gets, the easier it is to make it stronger. So we want to activate the vagus nerve. Chiropractic does a great job in moving the needle to a great degree. And then there's lots of other things. There's three broad categories. There's embodied, things that involve your body movement. In my practice, conscious breath work is a significant aspect of strengthening or tonifying the vagus nerve. There's also environmental. The patterns in nature called fractals have an incredible effect on the vagus nerve. And then there is relational. So spending time with people that you love and trust and that you feel safe with is key to activating the vagus nerve. So make sure to subscribe to my social media channels where I post regularly. Also visit my website, Life Within Chiropractic, where you'll find lots of great information. Thank you.